Let's be honest, getting ready for the USMLE can feel, well, completely overwhelming. You're looking at a mountain of information, and it's easy to feel lost. But here's the secret. The key isn't to memorize every single page of every book. It's about mastering the high-yield concepts that show up over and over again. So in this explainer, we're going to crack the code on some of those big-ticket topics to help you study smarter, not just harder.
We're going to tackle 4 key areas that are notorious for tripping people up: biostats, those tricky clinical vignettes, biochemistry, and of course, genetics. By the time we're done here, you're going to have a really solid framework for walking into these questions with a ton more confidence. First up, biostats. I know. For a lot of us, this isn't exactly the most exciting topic. But trust me on this one, once you nail the basic framework, these questions become free points. They're actually a huge confidence booster. So let's turn these wordy problems into simple, solvable puzzles. Okay, here is a classic biostats question. You're going to see something just like this. We've got 2 groups, 100 people with asthma, 100 without. We have their test results. The question wants the positive predictive value. Before we jump to the next slide, just take a second. Think about how you'd set this up. The 2x2 table is your absolute best friend for these questions. It's your secret weapon. Let's just plug in the numbers. We were told 56 people with asthma tested positive. That's our true positives, which means the other 44 must be false negatives. On the other side, 12 people without asthma tested positive. Those are our false positives. That leaves 88 true negatives. See how clean that is? The grid just organizes everything for us. So what is positive predictive value really? All it's asking is this: if your patient gets a positive test result, what are the actual odds they have the disease? It's all about how much you can actually trust that positive result. Simple as that. And now, believe it or not, we get to the easy part. The formula is just true positives divided by all the positive tests, so true positives plus false positives. We just pull the numbers from our table, 56 divided by 56 plus 12, and that gives us 82%. See, the hard part was just setting it up. The math itself is straightforward.
Okay, so just like with biostats, clinical vignettes are all about spotting the patterns. The USMLE absolutely loves to test if you can wade through a patient's story, pick out those key details, those little buzzwords, and land on the right diagnosis. Let's see how it's done.
All right, here's a super typical vignette. As you're reading through it, what words are just jumping off the page at you? What parts of this patient's story feel like they're the most important clues to solving the case? Did you spot them? I bet you did. We've got a 12-year-old boy, he's obese, he's got hip pain that's been around for a little while, and he's limping. Every single one of these details is a crucial piece of the puzzle. And when you put all those clues together, they point like a giant neon sign to one classic diagnosis: slipped capital femoral epiphysis, or SCFE. It's just a perfect fit for everything we were told about this patient. This is what we call a classic illness script. You need to burn this into your brain. For the USMLE, if you see an obese adolescent boy complaining of hip pain, your mind should immediately scream SCFE. It's exactly the kind of pattern recognition they're testing. All right, let's pivot to biochemistry. This is a subject that can feel like a bottomless pit of details, right? But here's the good news. For the USMLE, a lot of the time, all you need to know is that one key fact, that one little thing that separates 2 diseases that look almost identical. This is a perfect example. Tay-Sachs and Niemann-Pick. Both are lysosomal storage diseases, both can present with developmental regression, and both can have that classic cherry red spot on the macula. So how in the world do you tell them apart? It all comes down to one thing. You look at the liver and spleen. Tay-Sachs, no hepatosplenomegaly. Niemann-Pick? Yep, there it is. That single finding is the whole game, and it's a favorite question on the exam. And finally, let's talk about genetics. This field is exploding, and the USMLE wants to see that you can connect the dots, from a patient's symptoms and their family history, all the way to a specific genetic syndrome and even the gene mutation itself. So check out this case. You've got a patient with a thyroid mass from the parafollicular cells, plus a pheochromocytoma, and his dad had a similar history. Okay, alarm bells should be going off. What genetic syndrome should be at the top of your list? This is the classic triad for multiple endocrine neoplasia type 2A, or MEN2A. It's made up of medullary thyroid carcinoma, pheochromocytoma, and parathyroid hyperplasia. A fantastic mnemonic to lock this in is just TPP. Our patient in the vignette had 2 of the 3, which is a massive, massive clue.
And here's the final step, the connection they love to test. You have to connect the MEN2A syndrome to its genetic cause, which is a mutation in the RET proto-oncogene. That link right there, that's a high-yield fact that can make a real difference on your score. So as you've seen, whether it's the 2x2 table in biostats, the illness scripts in clinical vignettes, or the triads in genetics, the USMLE is a test of pattern recognition. Your biggest asset isn't just brute force memorization. It's training your brain to see the connections and spot the classic presentations. So as you go back to your studies, I want you to think about this. What are the patterns, those high-yield associations that you still find a little tricky? Make it your mission to master them, just one by one, because that is the absolute key to turning all your hard work into an amazing score. You've got this.